preterm birth is birth before 37 weeks of pregnancy. It's a serious health problem that costs the United States $26 billion every single year. It's also the leading cause of infant death. I'm happy to say that our state's health officials have agreed to work with March of Dimes to give every baby a healthy start in life. Currently, we are at 12.7%. This reduction would put the Arizona preterm birth rate at 11.7%. And one way our health officials are tackling this issue is through an educational campaign with the March of Dimes to let pregnant women and their health care providers know that healthy babies are worth the wait. Through public service announcements and patient education that will be distributed in hospitals, healthcare centers, health clinics throughout Arizona, women will be advised that if their pregnancy is healthy, it's best to wait for labor to begin on its own rather than scheduling an induction or a C-section. Right now, I'd like everyone to turn to the screen. This is a PSA that March of Dimes has co-branded with the Arizona Perinatal Trust and the Arizona Department of Health that hopefully all of our TV stations throughout Arizona will be running to encourage women to wait out their pregnancy.
Every day, it's getting closer, going faster than a roller coaster. A love like yours will surely come my way. Hey, hey, hey. Every day, it's getting closer, going faster than a roller coaster. A love like yours will surely come my way. Hey, hey, hey.
Babies aren't fully developed until at least 39 weeks, which means babies born even a few weeks early can have breathing, feeding, and learning problems. If your pregnancy is healthy, wait for labor to begin on its own. A healthy baby is worth the wait.
Well, I wish it was that easy to walk into a room and come out and have a baby. Yeah, I went 42 weeks, so I do remember how those last few weeks are. But I will say that just waiting, that makes all of the difference. There's no reason to go early if you don't have to. I want to first just acknowledge some of our speakers here today. We have Will Humble and Sheila Sjolander from the Arizona Department of Health Services. And we also have Dr. B.J. Johnson from the Arizona Perinatal Trust. And they're going to be sharing a little bit on how exactly we're going to reduce this preterm birth rate. And over on the other table, we have April Neal, Lori Skutnick, and Maggie McCracken. They are all March of Dimes volunteers, and they are also mission moms. All of them have had a premature baby, or in Lori's case, babies. So they will all be available for interviews right after. So right now, I'd like to turn it over to Director Will Humble.
I just want to take for a few minutes and sort of give a big picture here. The people in my jobs across the country, once a year, pick some sort of a public health intervention where we have a leverage point, where we can really make a difference quickly and change lives and change the lives of kids and families. And this year, the Association of People in My Job, it's called Arizona, or the ASTHO, Association of State and Territorial Health Officials, or ASTHO, picked this concept of preconception health and keeping babies inside as long as they can, especially hopefully up to 39 weeks, because that gives the kid the best chance of a good outcome. And so what we're going to talk about here today is a host of public health interventions that taken collectively we think can make a big change and reduce by potentially as many as 1,000 the number of kids that are born preterm in Arizona. And so there's going to be you'll hear a little bit more about the kinds of things that we can do as a public health system to make that difference. Some of those things include basic concepts like preconception health. In other words, keeping young women healthy in their reproductive years, because half of pregnancies are unplanned. So it's not like you're saying, well, I'm going to get into shape now because I plan on getting pregnant. That's not good enough. If you stay in good shape in your reproductive years, then when you do have that unplanned pregnancy, you'll be in a good position to have a good outcome because you'll have, and Sheila's going to talk a little bit about that preconception health. There's other things that we can do sort of at the retail level within the public health system, and that means getting into high-risk areas to do some home visiting opportunities to get that one-on-one conversation going between young women and a mentor to help them around the concept of staying healthier and around keeping kids in for 39 weeks. So there's a home visiting aspect. Sheila, are you going to talk about WIC a little bit? The Arizona Department of Health Services runs the Women, Infant, and Children program, where we see thousands of young women, moms every year, and have lots of mentor opportunities to really hone in on this conversation about preconception health and keeping babies, that babies are worth the wait. 39 weeks is the goal, which is, by the way, almost 10 months, not 9 like everybody thinks. So without going into too much more detail about the kind of specific things that we're working on, I'm really excited about this presidential challenge with the ASTHO group. Some of the states, I think probably about 40 of the 50 states have agreed to take this challenge on. I'm really proud that our state has taken this challenge because I think we have the tools in place to really make a big difference. So I'm really excited about it, not just as a public health official, but for the real impact that we can have with real lives. So Sheila, you're next.
I want to start with a little historical perspective to put this whole challenge into perspective, because 80 years ago, Arizona's infant mortality rate was about 20 times higher than it is today. So you can see we've made tremendous progress over the decades, and that's occurred through lots of different interventions, public health interventions like immunizations, medical advances, of course, prenatal care, and having a coordinated, regionalized system of perinatal care that we have in Arizona. These have all really contributed to our great public health success. So we've made progress. We're continuing to make progress, but our progress is kind of slowed down. We still have over 500 babies a year that die before their first birthday in Arizona. So we know that there's more we can do. And certainly not all infant death and not all prematurity is preventable. We know that. But there are steps that we can take to reduce some of the risk factors that we may have. Now, prenatal care is really important. I don't think anybody would argue with that, but it's not magic. We can't expect the best prenatal care available to us to be able to fix and undo damage that we may have incurred from years of unhealthy behaviors or living in really stressful environments. So it's really no substitute for being healthy overall. You know, in the past decade, there's been this mounting scientific evidence that's all concluded that to really move the needle on pregnancy outcomes and to have healthy babies, it's extremely important for people to be healthy before pregnancy, what Director Humble was referring to. So this is known as the concept of preconception health. It's really simple. It's a no-brainer. It's that healthy people are more likely to have healthy babies. So what does this mean for us? In public health, it means some of the same messages we tend to promote in general about being healthy, but I want to focus on a few that I think are really important. First, be smoke-free and avoid alcohol and drugs. We know that women who smoke during pregnancy are much more likely to have babies that are born too early or to be too small. And we know of no amount of alcohol that's safe during pregnancy. Second, take care of your teeth. Gum disease can actually contribute to women going into labor early, so it's important to brush and floss and see your dentist. Manage any chronic conditions that you have, like diabetes and high blood pressure, before you get pregnant. Of course, get tested for STDs, get those sexually transmitted disease treated, and make sure your immunizations are up to date. And take steps to manage your stress. Stress is really a huge factor in terms of our pregnancy outcomes. So take steps to manage your stress, and if you're feeling depressed, seek out help. And a note about folic acid. Folic acid is incredibly important. We've sort of heard about this a lot, I think, in terms of the importance of taking folic acid early in pregnancy, but it's actually important to take it before you're pregnant. You can get the recommended daily amount typically through a multivitamin. So folic acid is critical because it helps to prevent certain birth defects that occur really early on in pregnancy, often before women even know that they're pregnant. For example, spinal defects occur like around 28 days after conception, clearly oftentimes before women know they're pregnant. And last but not least, maintain a healthy weight. Of course, through eating lots of fruits and vegetables and getting good physical activity. Now, the problem of obesity is actually of great concern in this battle to reduce prematurity, because women who are obese are at much higher risk of having premature births and of having some birth defects and even infant death. So obese moms are obviously at greater risk of having gestational diabetes, hypertension, preeclampsia, all conditions that are associated with preterm birth. So we know that with the increase in obesity in Arizona, in our country, this is something we really need to address in order to have healthier babies. So Arizona Department of Health Services is really proud to join other organizations like the March of Dimes, the Centers for Disease Control, the Institutes of Medicine, in this whole approach and promotion around preconception health. And I just want to outline a few actions that we're taking within the Department of Health Services. Will alluded to a few of them already. We are integrating preconception health wherever we can into our existing programs, including our home visiting programs that work with young families to help them better prepare for their next pregnancy, as well as our WIC program. We have a preconception health task force made up of partners across the state, and you're welcome to join us in this endeavor. We work together to implement a statewide preconception health plan. We're also funding projects at the local level that address preconception health in terms of education for young people as well as providers, and taking action like influencing school policies so we have healthier school environments. And lastly, doing things like this today where we're promoting awareness of the importance of preconception health. So I think most of us know what to do to be healthy in general, but sometimes we lack that motivation when we're only thinking about health in terms of ourselves. But really the choices that we make are not just for ourselves, they're for our children, not yet born, and they're for the next generation to come. So for more information, we have some great preconception health, Every Woman Arizona packets. We're on the back table, and those are available on our website in English and in Spanish. And we also have a new Healthy Babies website that you can find at azdhs.gov/baby. Thank you.
First of all, I'd like to ask how many people here in the room know about the Arizona Perinatal Trust and what it does? Amazing. 30 years ago, the Arizona Perinatal Trust was formed in a process to help with neonatal outcomes in the state, but has evolved over the time frame to represent a total perinatal voluntary nonprofit organization that certifies hospitals and their quality of care in the state of Arizona. Currently, 40 hospitals out of 46 in the state of Arizona are part of the Arizona Perinatal Trust. So when you see a helicopter flying with a mom in it, you know that that regional system that was designed some 30 years ago is responsible for the care of that mother. Matter of fact, it's probably the best kept nonprofit secret in the state of Arizona. millions of hours of volunteer time, physicians, nurses, lay people, going week after week on Fridays, which everybody wants off, to go to do site visits across the state in these hospitals who wish to participate in this. So today is a great, great day for me as chairman of the Board of Trustees to collaborate with the March of Dimes and ADHS on processes which we believe are some of the most important things that we can do for our state. Last June, the trust in its hospitals that are certified, we rolled out the hard stop 39, no deliveries, no elective deliveries less than 39 weeks. 40 out of 46 of the hospitals, I'm proud to report, have moved in that direction and now have a hard stop for any elective delivery before 39 weeks. I need to thank Beth Mulcahy for her work with us in order for us to be able to institute this process within the state of Arizona. And thank goodness, because I think if we measure now, almost a year later, we may already see a change in those babies that are delivered what we call late preterm birth, between 34 and 37 weeks. Too often we have women who want to have their baby on a certain day because the grandparents are in town, or as we were talking about earlier, and these are the stars of the show, by the way, right over here, the moms who've been through the process. Things like the number on the back of the jersey, wanted to have their baby on that particular day. Those kinds of pressures for practicing physicians and wanting babies on particular days are pressures that have been difficult for us to make sure that physicians educate their patients early on and have the ability to say no. That's a very difficult thing to do. So I think we have an opportunity here that not many other states have. We've already sort of got into the process. We have gotten into the process, and we're moving forward, I think, at flank speed. Other issues with preterm labor. I love that song. That's a great phone ring. Other processes that we are so happy to collaborate with is going to be the new preterm labor toolkit. Obviously, preterm labor is one of the most difficult things for physicians to sort. The definition of labor, obviously, is progressive effacement and dilatation of the cervix in conjunction with timeable contractions. But many times ladies will, for many reasons in Arizona, such as not enough oral intake, dehydration with the weather, we can all go outside and it won't be long before we would all be having cramps. But basically, we have a hard time recognizing true preterm labor. I think the new toolkit that's coming out will give us a definition, a process, and we will be rolling that out in our hospitals as soon as it becomes available. And we know there are regional differences, and that's going to be hard, as our region here is very likely to treat as opposed not to treat, and it's very difficult to educate both the patients and the providers with that sort of information. So we're going to have some pushback when that happens. I hope that it becomes an evidence-based issue that we can all promote and embrace. With that, I think we can make some inroads to preterm delivery and preterm labor in our state.
Thank you, Dr. Johnson. This concludes our news conference for today.